In this episode, I want to share a little bit with you about the hardest client I've ever had and the hardest client you'll ever have if you ever decide to become a therapist. I also just want to go through some of the things that I learned in my first year as a clinical trainee, as a grad student, as a human being, and touch on some things that I think might be helpful for others who are deciding or considering going down this same path. And I have my cozy emotional support Christmas blanket here because it is December in Northern California and I'm freezing. If you've ever wondered what being a psychotherapist is really like, or if you're living it yourself, you're in the right place. I'm Gabriella, I'm in grad school, and I just finished my first year of grad school a few months back and started my clinical training this year. If you've watched any, if I seem nervous, it's because I am. If you've watched any of my previous videos, I'm usually very scripted and very structured in the way that I approach making content. It probably comes from many years working as a host, a television host, an actor. I did write a couple notes just to keep me on track. But yeah, here we go. I'm Gabriella, therapist in training, sharing my grad school journey to engage, empower, and educate. I'm Gabriella, and welcome to my YouTube channel. So what do I mean by the hardest client I'll ever have? As a clinical trainee, therapist in training, I, of course, do my own therapy, which is so wonderful on so many levels. First of all, because I think that everybody should go to therapy. I'm a little biased. But also, we have, as clinical trainees, we have the added bonus of kind of using our own therapy for consultation, in the sense that because they have the lived experience of being a professional licensed therapist, they can relate and engage with us on a level that is both professionally and personally fulfilling. So I don't know what the rest of y'all therapists are doing out there in your therapy sessions, but I've definitely taken advantage of that. And there's something that my therapist said to me that I will never forget. She said this to me when I first started seeing therapy clients. And she said, "Gabby, you know you're your first client, right?" And that statement just kind of blew my mind a little bit because on the one hand, I've always understood the value and importance of doing the inner work while you are in this field and while you're pursuing licensure. But on the other hand, I never thought of it quite like that. So when I talk about the hardest client, what I really mean is it's the work you do on yourself that is truly the most challenging. And that commitment to your own therapy, your own personal growth and well-being essentially underpins the idea that you can't guide other people to go to places that you're unwilling to go yourself. Yeah, of course, I don't want to be a hypocrite with this work. And also, my ability to empathize and have compassion for people who are struggling in their own journeys, or whether that's reconditioning old beliefs or redefining relational dynamics in their life. I personally know from my own experience how difficult those things can be, and that everybody gets there on their own timeline. And I think it's that emotional component of this work that sets this profession apart from so many others because it is such an experiential process. The element of internalizing the work for yourself has made me a much better clinician on so many different levels. And something I like to do whenever I'm learning like a new solution-focused therapy technique is that I immediately take that tool and I see how I can incorporate it in my own life. It doesn't have to be about something big. It can be about the smallest thing. Like in DBT, there's this it's called wise mind. And basically it's the idea that we have a rational mind. We operate from our rational mind sometimes, and other times we will operate from our emotional minds. And the idea is not leaning fully into the emotional mind or fully into the rational mind, but looking at problems from the wise mind, which incorporates and respects the emotional aspects of who we are as a human being and the rational aspects of the human being. And I can literally apply those principles to any aspect of my life. But that process of internalizing it and either applying the approach to your own life or using it in some way before sitting across from a client and asking them to explore these concepts is not only valuable, but it lends to your credibility as a clinician. And even though your client might not know that, yeah, I have actually applied these techniques to my own life, you know that. I think people can intuitively identify Well, first of all, others' lived experiences, right? Like there's a difference between having a conversation with somebody who doesn't share your lived experience and somebody who does, even if you don't actually know if they have or not. Humans are a lot more intuitive than we think. And the same thing can be applied to whether or not a clinician really believes in the things that they're speaking about, or whether they're just regurgitating information from a textbook or a study. And sometimes you will be regurgitating information from a textbook or study because it's new and we haven't, as clinicians, even had a chance to internalize it for ourselves. And that's just the nature of psychology and the field. We're always learning. There's always new studies that are coming to the surface. Okay, so that's what I mean by the hardest client I'll ever have, because we are all experts when it comes to someone else's conflict or drama or issues, right? We're quick to dole out advice or offer a suggestion or even just offer space and compassion. But sometimes offering those very same things to ourselves is challenging, whether it's not being so hard on ourselves or whether it's speaking to ourselves with kindness and compassion, or whether it's just giving ourselves grace for not having the answers or making the same mistakes in our relationships that we've made for many years. At the end of the day, we're all human and fallible, and your therapist is no exception. Okay, so switching gears a little, this year I started my practicum and my placement was at a community mental health center. It was a very large organization with a lot of satellite locations that do different things. And at my particular location, their primary focus when it comes to client care is psychosocial rehab. Psychosocial rehab really has to do with those more tangible aspects of support that a client could need. So it could mean therapy. It could mean getting assistance with finding housing. It could be assistance with transportation. It could be helping a client restructure a resume. It could be linking them to support services like people who have alcohol use disorder or who are fighting addiction. It really depends on the needs of that specific client. So where I come in as a clinical trainee is I, at my site, am tasked with conducting assessments on clients in order to qualify and enroll them in the program. So the way we enroll potential clients is that they have to have a DSM diagnosable disorder. So that could be PTSD, it could be borderline personality disorder, it could be anything. It could be bipolar 1, bipolar 2, it could be schizophrenia. We conduct a lengthy assessment process. It could take a couple weeks, anywhere from like 2 to 4 weeks typically. And part of that assessment is quantitative, part of it is more qualitative. Overall, it's pretty qualitative in general. So we do spend a lot of time really making sure that we have a holistic picture of the client and their needs and what their diagnosis is. And then from there, once we've determined that they are eligible to enroll in the program, they are basically assigned a case manager, and that case manager will engage with them in the form of psychosocial rehab. At that point, they can assign them to a therapist if that's one of their needs. And I, as a clinical trainee, also take on therapy clients. So my role is kind of twofold. This whole experience has been one of the most challenging and fulfilling and rewarding of my life. I'm not gonna lie, when I first started, I was super overwhelmed, mostly with the amount of paperwork at my site. I know that's not the most sexy or exciting thing. I didn't think so either, but we get our funding mostly from the county. So there is so much paperwork that goes into enrolling a client into our system and making sure that we're getting the funding for the program, for billing things in the right way and updating things appropriately. So it's a lot of paperwork. And then in addition to that, the assessment process involves a lot of paperwork and really qualitative analysis about the individual. So the learning curve at my site was pretty steep. And yeah, it was legit overwhelming when I first started. Now I'm definitely more in my flow and I feel really supported by the people at my site. And I feel like I have the, I'm like fumbling over my words right now. I'm thinking about those early days in practicum when I was just like, oh my God, did I choose the right site? But I did, and I'm really happy now, and that's how I'm able to talk about it. I'm like, I have to make sure this isn't an open wound. It's a scar, people. I'm scarred. And what I mean by that is It was a challenging onboarding process, but now I'm in a position where I'm like, oh, I had to go through that to get where I am now, and it was worth it because the amount that you learn in such a short amount of time and the amount of responsibility, at least at my particular site, is a lot. And then on top of that, you're dealing with real people who have needs and concerns and sometimes are actively in crisis. So you're trying to balance both adjusting to all the administrative tasks associated with your job as well as balancing the emotional demand of the job as well, which is where I feel like I thrive. So some of the more administrative things that were tough, and I think I would imagine that that's probably a relatable thing for a lot of clinicians because we are such people. We're people oriented. So the last thing we want to do is be typing away behind a screen, but it's an essential part of the process, and you just have to learn to embrace it, like any job, right? So the other element to all of this is the oversight in this process that is the foundation of everything we do, in my opinion, which is our supervision. So while when we're in the room with clients, it is just us and the client, and we have signed a confidentiality agreement with them. So everything they share with us stays in the room. The only exception to that is when we're doing consultation with the case manager, at which point we're probably discussing more logistical aspects of the client's needs versus emotionally intimate details that they shared in therapy. That's not really something that would be needed or appropriate. But the real exception to that is when we engage in supervision. So every clinical trainee is required by the state of California to engage in an hour of supervision a week to discuss their cases, their clients, their needs, questions, or even personal needs that you might have as a clinician. Maybe you're experiencing countertransference. Maybe you're finding it personally difficult to work with a particular client because their traumas are similar to your traumas. It could be anything. For me as a new clinician, this component of my education has been invaluable because I love the learning process and because I love to unfold and dissect and peel the layers apart when I'm working with a client and trying to understand how I can best support them, understand them as a full human being, and then to be able to have somebody else who is licensed, who has much more experience and knowledge than I do, to consult with. When I've talked to licensed clinicians about their experience in supervision when they were doing their clinical training, a lot of them say the same thing, which is that sometimes your supervisor can make or break your experience in clinical training, which is why I am so grateful. I have a supervisor that I feel like I can go to her with anything. And she always has a really great insight or tool or article or even book to recommend to me that allows me to be a better clinician to my clients. And one thing I'll add to that as well, which is unique to my site, is that because we are a site that limits each client to up to 6 months of therapy, our approach has to be more solution focused, meaning we create a treatment plan with the client and then we have 6 months to work with them. So it's really essential that in our treatment plan, we have concrete and tangible goals that throughout the process, throughout the 6 months, that we are providing the client with tangible takeaways. So it's a little different from, say, a more psychodynamic approach or more existential approach to therapy in that we are looking at a very specific timeline that we have to work with a client. So in a sense, you could say it's like a little added pressure, but on the other hand, I like the fact that solution-focused therapy relies on providing tangible tools and not just vague insights. I mean, I'm somebody who loves to just go deep and explore. My own personal preferences as a clinician lean in the more psychodynamic realm. Think Carl Jung and Freud, but I like the idea of learning this approach because in my future practice, I'm sure I'll have clients that will come to therapy for a short time, and I want to make sure that they have something valuable and tangible that they can take away with them. And I think that for a lot of people, therapy is something they come to in seasons of their life, either because they're in crisis or because they're going through a very significant life change and they need support in processing those big changes in their life for a short-term period of time. So I can definitely appreciate a lot of aspects of solution-focused therapy. Okay, so for lack of a witty segue, I want to talk about some strategies that have helped me grow personally. And I think one of the main things in this area is, as a new clinician, being okay with not knowing, and recognizing that your clients, their needs, their stories will unfold at their own pace as you build trust, as you build rapport. And the thing is, everyone works at their own pace. But I've noticed that this field is so deeply plagued with a sense of imposter syndrome. And I did a whole episode on this, but I think that comes from this like expectation that as new clinicians, we're supposed to have the answers. And that's just not realistic, and it's an impossible standard to uphold. Even the most experienced clinician, psychologist, psychiatrist is not going to have all of the answers at their fingertips for every possible issue, concern, or experience that a client brings into the room. And I think that willingness to be patient with ourselves, to be patient with our clients, and to trust that things will unfold as they unfold at a pace that we cannot control is really critical, because sitting with uncertainty is uncomfortable. And I think it goes both ways, right? Like whether we're going through a life transition or whether we're entering into a new romantic relationship, there's a lot of anxiety associated with not being able to control the outcome in any given situation. And just to humanize clinicians for a minute, there's also uncertainty in sitting with a client that you may be unsure in terms of how to best support them. A lot of what we do as clinicians is limited to how willing a client is to share the details of their circumstances and the level of self-awareness that client already has about those experiences. You might work with some clients that come into the room with all kinds of awareness about what they've been through. They've processed it. They've read some really great books on the topic. They kind of speak the language and they have a handle on what their needs are. And you have other clients come in that are, in essence, looking to you for the answers, or at least the support. And so I think when it comes to this uncertainty around working with certain clients, it's so important, or at least it has been for me, to lean into the self-acceptance of being okay with things being where they're at. What works for me is reminding myself that no matter what, I'm going to show up for this client and model the stability and presence that will create the safety they need to be able to open up and engage in self-exploration. Sometimes what we need as humans is just to know that someone's going to be consistent and available for the moment when we actually feel comfortable to share more about ourselves. I guess the short answer here is when I'm feeling any kind of self-doubt as a clinician, I really allow my deep sense of caring and compassion, commitment to clients to really just be my North Star. At the end of the day, I can always learn more about whatever it is I need to learn, but the self-trust that I have and my ability to be present isn't going anywhere. Okay, so we've talked about my hardest client, which is me. I've talked about my experience in practicum and what I've been learning, how I'm learning to work with clients. The last thing I wanted to touch on was something that was a bit unexpected that came up quite frequently in my grad school program, in my cohort. I didn't realize the insecurity I had around communication. As somebody who is doing a YouTube channel, as someone who's worked as a television host, this was a surprise for me. And I think it's rooted in this fear of either oversharing or sounding uninformed or just like being annoying because I get super passionate and I like to dig in and I'm really curious. I like to ask a lot of questions. So that's how I learn and that's how I engage in class. And I realized that most people in class aren't that way. So I kind of stuck out in that sense. I also remember when I was in college, which I did in person, I had a girlfriend and we were both in the same lecture hall. I didn't know her at the time, but I remember her saying later, she basically described me as the know-it-all that sat in the front of the class. And she's my best friend. Shout out to Becky if you're watching. But that stuck with me. And she didn't mean it to be rude or anything, but it was just like her observation or like her first impression of me. And I shared with her that, Becky, I sit in the front row and I engage in class because if I don't do that, I will literally not learn. I have to engage and be stimulated, and I'm a verbal learner because I will zone out if I don't engage that way. So I think because of that, I started to get in my head around if I was taking up too much space in my classes and in my lectures. And I've definitely let that go a bit, but it was something that I had to once again like lean into self-acceptance and realize that I am this way, and that's okay. That's how I learn, that's how I grow, that's how I experience things, kind of on this really like visceral level. I don't know if this is accurate or not, but this has been my experience that a lot of people in this field are very introverted, and coming coming from an extremely extroverted field of working in entertainment, it's been really interesting to exist in the space where I'm the outlier as the extrovert in the classroom, or at least one of the outliers. So yeah, leaning into self-acceptance around the way that I learn and the way that I communicate has been critical. And it's also related, of course, to how I decided to structure this episode today, is not to structure it at all, to be a little loosey-goosey and not scripted. It's a way that I like to consume content. I want to feel like the person that I'm listening to and engaging with on a weekly basis is a real person with insecurities and vulnerabilities, who sometimes overcompensates to cover up those things. So little by little, we grow and we change, and this year has changed me so much, definitely for the better. It's been hard as hell, and I don't regret a minute of it. This is going to be my last episode of 2025, so if you've been following me on this journey so far, thank you so much. Every like and comment and view means so much to me. It's always great to be able to answer a question or hear from somebody in the DMs, so please don't hesitate to reach out. Whether you have a question about this field, or you're currently in grad school right now, or you're considering it, I'd love to hear from you. Dear future therapist, from the bottom of my heart, keep learning, keep growing, and I will see you in 2026.